Hey, NerveSpa family. Scott here with Dr. James Perkins, Youngstown, Spine and Disc. Um, and the doc has agreed to chat with us about our products and kind of what's kept them around all these years. So, James, I appreciate you making some time to talk with us, and let's get to it. I know you're busy treating patients. So, my first question, actually, I have a couple questions, but my first question is, all those years ago, what motivated you to give us a shot? And just as important, after all these years, what's kept you around?
Yeah, man, awesome questions there. So I'd been researching PMT for a few years before I think I even jumped in and started working with you guys, just because of your product line, the product offerings between the nerve spa for neuropathy, and what really intrigued me was the knee pro. Um, as I was launching, I took over my practice. A quick story about
Sure.
myself here. I launched my practice. I bought an existing practice out that was already doing a little bit of knee pain. And this was about 3 years ago, whatever it was at this point when we started working together. And I was in my research of PMT, I found that the knee pro, and I was treating some knees. We're doing laser and knee on track in office. And once I added the knee pro for at home, so we do a hybrid in office and at home program. And once I added this, I mean, my results just exploded through the roof. I mean, we're getting 50 to 80+% in bone on bone knees, which is fantastic. So in short, I guess that's what drew me to you guys, just with the product offerings, and then why I'm sticking around is because the product works.
That's awesome. So I knew you've used a few of our other items over the years, maybe a nerve spot here and there, some light therapy. Um, Similar experience with those I mean, I'm opening myself up to a can of worms here, but because this is definitely not scripted. But what's your experience? I mean, sounds like you've had some really good experience with the knee pro, but what about our other stuff?
Yeah, so the other two products I primarily use is the LED wrap, and we're using that for neuropathies. Similar program in office. We have a program where we use laser, PEMF, a few other things as well, and then we have that hybrid in office and at home. So the at home portion of that, we turn patients loose with the LED wrap, and I've also implemented the quake plate, which patients absolutely
Yeah.
love.
That's awesome, man. You've made this really easy on me. I mean, I don't even have to do any follow-up questions. You've kind of covered it. So yeah, we've been working together for several years, and you know, been an awesome partnership. And listen, we all like to sell stuff, but hand to God here, it's really awesome when you hear back from your customers and from their customers that the products are doing what they're supposed to be doing. So I'm glad your patients are getting good use out of our stuff and getting better, and I'm glad that you're continuing to have a good experience. So, like I said, this you kind of laid this out for me real nice and neat. So unless there's anything else you want to add, we can call it a wrap. And hell, I'll let you get back to treating patients and maybe selling more of our stuff.
Yeah, man. Just one extra piece here. Products are good, but people make the experience. And Scott, you've been fantastic.
Oh, geez, man.
Anything
Thank
that
you.
I've ever had, you've been there. You pick up the phone, and that's I only work with people that I like to do business with. A of all, and I like to do business with you guys. And a primary
Thank you.
reason I've continued as well. And in addition to driving the patient outcomes is most important, but having a point man and you. It's been fantastic. So I truly appreciate that. And I know my patients do as well.
Man, I'm a little verklempt, man, but I appreciate the kind words, and you know, I'll look forward to doing another one of these 5 years down the road. So anyway, James, listen, thanks for the time and the kind words, and you know where to find me if you need.
Sounds great. Good
All
talking to you,
right,
Scott.
you enjoy your day.